let me first say that the community health centers in America started right here in Boston. And the first health center in America was the Columbia Point Health Center in Dorchester. It was started by two doctors, a doctor named Count Gibson and a doctor named Jack Geiger. Count died, but Jack is still alive. He lives in Brooklyn. And 50 years ago, he went to South Africa. After the South Africans created their apartheid system and moved the black populations into their what they call homelands, you know, Ciskei, Transkei, and all that. There were some doctors who wanted to make sure that there was access to health care. So it was the Kark, I think it was a couple named Dr. Kark, and his wife was also a doctor, I believe, who went to one of the homelands and set up a clinic, and then wrote about it. Dr. Geiger and Dr. Gibson heard about it and decided to visit. So they visited this place in South Africa, and they said, wow, this could work in areas that don't have access to health care in America. So they came back in 1964 and approached the federal government in Washington, the Office of Economic Opportunity under the Johnson administration, and said, we want to build a couple of pilot health centers. The first one was Columbia Point Health Center in Dorchester. The second one was Mound Bayou in Mississippi. And so the fact that, and these were both were Tufts medical school professors. So the reason why Boston was the first place, the reason why Massachusetts has so many health centers that are old is that Boston and Massachusetts were the first places in America where health centers started.
When people here in Massachusetts, they mention your name, Bill Walczak, and health or community health center, your name is really, associated with Coleman Square Health Center. And before we talk about the South End Health Centers, can we go back in the years when you created the Coleman Square Health Center?
Yeah, it was, just so you know, what happened to me was that I actually grew up in New Jersey, and I had a scholarship to go to school in Boston. And so at age 18, I came up to Boston, and some interesting things happened to me during my first semester here. One was that I got involved in the United Farm Workers lettuce boycott. I've always been oriented towards social justice, supporting poor people, and dealing with justice issues. And I was involved in the civil rights movement when I was a teenager. I was involved in anti-Vietnam War demonstrations. And so I came to Boston. I wound up meeting Cesar Chavez, and I decided to volunteer to help create the lettuce boycott here in Boston. Also, around the same time, I met my wife, who was from Dorchester, and she lived in Codman Square, and so we started our dating. So October of 1972, we started dating. And our dates were going to A&P grocery stores and handing out flyers asking people not to buy lettuce. So it was not terribly romantic, but in some ways it was very interesting. And then at the end of the year, at my first semester here in Boston, they were looking for people to go out west and help organize the boycotts out west. And so I decided to quit school. My girlfriend at the time said, I want to join you. Let's do this together. And I said, well, let's get married then. So we got married when we were 18. We went out to Denver, Colorado. We helped to organize the lettuce boycott in Denver. And we came back and moved into Codman Square. So I was 18 years old, 19 years old, living in Dorchester. I'd given up my scholarship, so I was working as a spray painter, and I started getting involved in community activities. Now, Codman Square was a very, very tough neighborhood in 1973. Yeah. And a lot of the neighborhoods were actually burning down. It was evacuation of the neighborhoods, which led to houses becoming abandoned and then burning. The commercial district was in a state of collapse. And so I started going to community meetings as a resident of that neighborhood. And at one of the meetings, it was discussed that the old library building, now called the Great Hall, was going to be closed. And the city was going to move the library out of that building. And that would have abandoned the building. And so people were worried that it would burn. All buildings that were empty in those days burned. So people started talking, what are we going to use that building for? And somebody said, let's start a health center. Well, I had never heard of a health center in 1973. But I asked a lot of questions about it, and being an enterprising young man at the age of 20, I raised my hand a few too many times, and the chairman of the association that we were meeting with at the time said, Bill, why don't you head up that committee to start the health center? So that's how I wound up starting the Codman Square Health Center. I was became the chairman of the committee to start the center, then I became the president of the board of directors to start the health center in 1975, and then when we opened up, I became the first director. So I didn't have any preconceived notions of what a health center was. I mean, I was a college dropout. So my view was, well, what the community needed sometimes was healthcare and sometimes it was other things. Most of the time it was actually dealing with some of the crisis and crime and drugs and violence and arson. Those are bigger issues than healthcare in those days. So I kind of led the health center in a different direction. I said, we're going to provide medical services, but we're also going to organize the community. We're also going to create crime watches and block associations. We're also going to help people deal with drugs and violence on their streets. And so that's where all this stuff came from. I started I was the co-founder of Codman Academy Charter School. Why? Because education is the most important thing you can do for people that are trying to come out of poverty. It's more important than healthcare. So the notion that somehow we were going to deal with poverty through healthcare, to me, was preposterous. No, you can try to keep people healthy, but ultimately education is more important in terms of pulling people out of poverty. And I saw poverty as the route to good health. So if you can beat poverty, you can probably have a healthier life. So for me, most of the things I did in Codman Square were about making sure that people had access to the kinds of things that would allow them not to live in poverty. So we started Daily Table up there, which is a food place where you can buy really low-cost, highly nutritious food. The HealthWorks Fitness Center, which is a very, very low-cost, beautiful fitness center up there. The farmers markets and things like that, the community organizing work, the Great Hall itself, which is available to people that want to organize themselves to do things. Those are all, to me, essential elements of a great community. And so I decided that Codman Square Health Center, if we wanted to really do something important and create a great community where people had more opportunity and access to the kind of resources they need to be successful, why not have the health center do it?
Now, 1973, 1974, since community health center was a new concept, where did you find the money to finance all those activities?
Money was always in tight supply. So there were a couple of different programs. I learned very quickly that that you could, at the time, get doctors through something called the National Health Service Corps. And so I applied for getting, actually I wound up with a doctor and a half-time internist and a full-time pediatrician. And with money that they were able to generate, because I didn't have to pay the government for those doctors. Those doctors were working off, they got scholarships to go to medical school in exchange for providing services in what was called an underserved area. So Codman Square was an underserved area. I mean, in those days, before the Codman Square Health Center came into existence, people would go to emergency rooms for basic medical care. Your kids needed immunizations, go to the emergency room because they couldn't turn you away from an emergency room.
Boston City.
Yeah, Boston City or the Kearny in those days. Those were the two hospitals people, and so regular medical care was taking place in emergency rooms, which is a crazy way to deliver health care. Yeah. So there was an interest on the part of government to make sure that people used a lower cost system for basic medical care. So that's where health centers came from. It was a lower cost way of doing it. And they also provided, in those days, free doctors. So I was able to get a great pediatrician and a great internist, and we were able to bill for their services to patients who had Medicaid, or charge them, I think it was $5 a visit at the time. And that allowed us to pay for a nurse, a person who kept the floors clean, and myself. And that was basically what we had. I was on the front desk. When we were open at night, I was the receptionist. I did all the billing. When the maintenance guy didn't show up, I washed the floors. I walked out every morning. I would go to a different street and to deliver flyers to a different street. And I was the executive director.
Now, how many staff, in terms of, administrative staff, medical staff, to serve how many people at that time?
Well, at the time, I remember when we had our 500th patient, and all of the medical records were on one bookcase. And then I remember when we had to take half of them and move them onto the second row. That health center has had probably 60,000 patients since then, and is currently serving 25,000 patients a year. 25,000 different people come there a year with 125,000 visits. There's a staff of about 300 people working there in over 100,000 square feet of space. I mean, it's really an amazing place. And it does all sorts of stuff, including starting schools. While I was there, we started 2 schools, the Edward Kennedy Health Careers Academy and Codman Academy. So there's a lot of things that health centers can do outside of the medical model. To me, the great thing about health centers is that they exist. They're nonprofit organizations. They tend to be located in low-income communities for all sorts of things beyond providing a visit of care.
You left, years ago, the healthcare system to get involved in politics, if I'm not mistaken, 2014. Why make you go back to, I would say, community services?
Well, so I left healthcare in 2012.
Yeah.
And I actually started working at Shawma Construction Company.
Mm.
It's one of those things. When you get older, you start thinking, what else is out there, right? And I always enjoyed working with Shawma Construction. They're a good company. It's an employee-owned company. Mm-hmm. And so they offered me a job as a vice president over there to do external relations, government relations, that kind of thing. So I decided I was going to do it. Now, it wasn't really a good fit for me. I'm much more inclined towards kind of...
social services.
Well, yeah, like...
community.
I'm on a mission, right?
Yeah.
I want to do something that really improves the quality of life, right?
Making a difference.
Right, yeah, exactly. Yeah. And so what happened to me, though, was that my wife got very ill. She eventually died of pancreatic cancer a little more than 2 years ago.
Okay.
But that's what brought me back into healthcare. I realized that my passion was in healthcare. I realized that the things that I was seeing as she interacted with the healthcare system that absolutely need to change. Mm-hmm. It's confusing enough. The American healthcare system is a confusing mess of a healthcare system. And I've been in it for 40 years. There are documents that come to me that I don't understand.
Yeah.
And imagine being a Haitian immigrant whose second language is English and getting some bureaucratic letter from the state government that talks about,
Medicare Part 1, Medicare Part 2.
Accountable care organizations. What the hell is that, right? And so you look at it and you say, okay, so I'm having difficulty managing the care of my wife who has pancreatic cancer. Imagine what it would be like to be a person who comes from another country, who doesn't have the resources to be able to deal with this kind of stuff. And I realized that, geez, my work isn't done in healthcare. So I decided to get back into healthcare in 2015, because of my wife's situation. She eventually died. And but I decided that this is the place where I want to be. Now the South End Health Center for me was a great opportunity. It needed somebody that knew a lot about health centers. One of the things I realized when I was going to go back into healthcare is I don't want to work until I'm 70. As a matter of fact, I'd like to retire at age 65. And I realized that going back into healthcare, that if I went back to an ongoing health center, that they would expect me to stay from 5 to 10 years. And I don't want to work for 5 to 10 years. I want to work for like 3 years, 4 years maybe. And so I decided that I needed to work in a place that really needed me and that was maybe in a little bit of trouble. This place was in a little bit of trouble financially, and they'd actually lost a good chunk of their medical staff, and it was kind of a bumpy period of time for South End. And so when I applied for the job, I realized this was a perfect place for me because it allowed me to use all my 40 years of experience in healthcare to try to figure out, well, what do we do next? And so it's worked out really well for me. I think it's worked out really well for the health center here. We're doing, we've completely restaffed. We have a great group of docs here. We're doing some really innovative things here.
Such as?
Well, we're doing this joint residency in psychiatry and family medicine. So here's the big issue. From the healthcare perspective, from the policy perspective, the highest costing individuals to treat in the healthcare system are people with both behavioral or psychiatric issues and medical issues, okay? So kind of the most common person you would see is like a homeless person, right? Lives under a bridge. The cost is enormous. They're in the emergency room continuously. Yet we see people, their behavioral issues, the psychiatric issues, as completely separate from their medical issues. And that's not a good way to think about things. We should be thinking about everything systemically. And so I had this idea about starting a joint residency program. So we would train doctors who were both certified in family medicine and in psychiatry. And so, I started talking. I recruited actually a very well-known family medicine doctor named Glenn O'Grady, who was in Boston Magazine as a top doc in Boston. And I recruited him here to start this program. So we just got permission last summer. We're starting our joint residency in psychiatry and family medicine this coming July. And we've had an enormous number of fourth-year medical students come through to apply for this thing. It's a big, big hit. There's only 5 programs in the entire country that are like this. We are the 5th program. The closest one to us is in Pittsburgh. There's some in California. But this is something that I consider to be extremely necessary, both for the healthcare system and for the patients themselves. Having somebody who understands them both psychically and physically is a really important thing. So that's something that we've just started here. I've been here for 2.5 years. It's kind of amazing that at the start of my 3rd year here, we will be able to start this new residency program that's tremendously innovative. And that's something this health center actually does quite well, is combining or looking at what's called integrated behavioral health. It's behavioral health services integrated with medicine, but now we're going to actually train doctors in that way. Another thing that we're doing early childhood programming. And so what we're doing is we're connecting our clinic, which is, this is our main building, but we also have another clinic that's over in a couple of blocks from here in the Blackstone block, which is next to Via Victoria Housing Development and the Blackstone School. So we have a clinic over there, and what our goal is to connect the children who go to that school, their younger siblings who will be going to that school but are, age 1 to 5 or whatever, the Blackstone Community Center, which is a fitness center that's run by the city, and the health center, and a daycare center that wants to move into that space, and so that we can get a comprehensive way of looking at early childhood. So from prenatal to preschool, we want to make sure that those children, especially children that come out of the housing projects, get all of the services and benefits that they need in order to make sure that by the time they reach school age, they're ready to learn.
Now, how do you reach this population? Because you go in there, it's not, you ask, the clientele to come here.
Our goal is to actually work with the students and their families of the 2 elementary schools, the Hurley School and the Blackstone, and find out who the younger siblings are. It's information that the school department doesn't collect. You'd think it'd be kind of obvious, right? You want to know who the younger siblings are because they're first in line to get into that school. First in line. They get preference for going into that school if their older brother or sister goes there. So, so what we want to do is we want to find the younger siblings and of children that go to those schools, because there's a lot of poverty in those schools. A lot of the children come out of housing developments that go to those schools. And we want to make sure that the younger siblings are being prepared to learn by the time they reach age 4 or 5. So we have access to a population. We have access to the families. Many of those children actually get their services, pediatric services, right here at the health center. But what we want to do is we want to reach down to their younger siblings and make sure those kids are being well prepared.
Now, in terms of staff, it seems, for all those programs, you need a lot of people with a different kind of expertise to go to these communities and serve them.
Oh, yeah. Well, one of the things we're very lucky, we're in Boston.
Okay.
Boston has a lot of training programs. And what I'm finding, actually, we're in the process of hiring a manager for our early childhood. And we had some great candidates. We just put it out on Ideal List and a few other places. And we had about 75 applicants for the
You
job.
say, okay, let's stop here. You say you are a community health center. You say you are going to hire a manager for early childhood?
Yes. Well, hey, the way I look at it is, we need to move into the space that's vacant right now.
Okay.
Right? Schools handle kids age 5 and up, right? For education, right? Healthcare systems take care of kids prenatal to preschool, but they're not focused on education because they're focused on physical health. We need to expand that definition of health to include preparation for school. So my goal in hiring this position is that our medical clinics expand their vision and their role to include making sure that children are prepared to enter school. And that requires a different way of thinking and a different way of training. I think, it's funny because right now, Johns Hopkins University, one of the great institutions for healthcare down in Baltimore, has just started a special part of their medical school that's on connecting education and healthcare. So this is not something that's way out. If major institutions are starting to look at, the connection between healthcare and education, hey, this is great because it adds credibility to what we want to do. But ultimately what it requires is actually we're going to have to change the training programs for pediatricians and for family doctors so that they understand, or that we develop the kinds of systems that are necessary to make sure that not only are the children being monitored for physical health, but that they're also progressing in a way that would enable them to enter school ready to learn.
Now, to serve, these children, what kind of, relationship do you have with the school system, with the teachers?
We operate a clinic inside of the Blackstone Innovation School. So in our and we have right now we have dentistry, behavioral health, and medical care going on in our clinic that's in the Blackstone. We also have a very strong relationship with the Hurley School. So we're in 4 other schools as well. So we have a strong relationship with 6 schools right now, with especially good relationships with our 2 elementary schools here in the South End. And that's long term. We've been connected with them for more than 20 years. Well, okay, so go back to Codman for a while. While I was there were 2 schools that I was instrumental in starting, right? Both of them focus on health careers, okay? The Edward Kennedy Eastern and Codman Academy, where all of the students do internships in healthcare, right? 18% of the jobs in Greater Boston are in healthcare. 18%. Almost 1 in 5 people work in healthcare. It's where the jobs are. Now, I looked at it and said, holy cow, we were trying to hire nurses and doctors and all that. They're like all white people. It's like, wait a second, why can't we get our own neighborhood people into these programs? And part of it is that the schools were doing a very poor job of preparing kids to get into the programs that are necessary. Bad in science, bad in math, bad in all those type of things. So I looked at it and said, okay, the purpose of these 2 schools is twofold. One is to make sure that they get an appropriate education that will allow them to go to a college where they can become health professionals. And the second is that they get some opportunity to actually intern in it. This is one of the things that middle class people just take for granted, is that daddy is going to get them into an internship in some kind of job that could lead to some sort of career, right? It doesn't happen in poor families. So what we wanted to do to be in loco parentis, right? To have an extra parental role in trying to get kids access to these job-oriented internships. So both of those schools do that. So if you look at it from the perspective of, like a typical kid growing up in, say, Franklin Field or something like that, they don't know a lot of professionals, right? They just don't know a lot of professionals, right? Their families probably don't have professionals. They're not middle class. They're living in a project.
No connection.
Right, so there's no connection to that world. So starting Codman Academy inside of the Codman Square Health Center gave them the opportunity to be in the same hallways as the largely African American, Haitian, Caribbean immigrant staff of the Codman Square Health Center, who are X-ray technicians, who are laboratory workers, who are doctors, who are dentists, who are social workers, who are fiscal people, billing, finance people, and all that. There's probably about 70 different jobs at the Codman Square Health Center, and most of them require a college degree. Some of them, like an ultrasonographer, it requires you to get a special certification. But these are all available to people. What we needed to do is expose kids to this vast array of jobs that are out there. It isn't just doctor, nurse. It's a vast array. And so what we wanted to do is make sure that those kids understood what was available to them. And some of these kids would get fascinated by laboratory, by actually working in the laboratory, where the laboratory the chief would allow them to look into the microscope and see, this is what a syphilis cell looks like, or whatever. Yeah. Kids were fascinated by that. And some kids actually went into laboratory science as a result of that. These are things that are really, really important that don't exist in low-income communities, but readily exist elsewhere. And that is to give the kids the same opportunity to see what they have available to them if they decide to move forward with going to college or going into a special program. And that's, to me, an economic development tool. The other thing that Codman Square did was, frankly, we renovated 100,000 square feet of space that was previously abandoned. All the buildings Codman Square is in were previously abandoned buildings. So from an economic development perspective, the main building in Codman Square was an old nursing home that closed. We bought the nursing home in 1988 and put, I think it was about $15 million in the original building that we rebuilt. And then we added another wing onto it that was another 11 or 12 million. And then another $18 million addition on top of that. So, so this is a big economic development kind of thing that took care of buildings that were abandoned. Codman Academy is in the old Lithgow building and in the building that used to have, actually it says Bank of, what is it called now? Bank of America right now. But that's now a good purpose for that, is the elementary school of Codman Academy. So economically it's really important. The other thing about it for me in Codman Square is looking at it as you have a commercial district, and that commercial district, which had a bad fire yesterday, was largely abandoned in the late 1970s. And so it needed some rationale for its existence. And I saw the Codman Square Health Center and, frankly, the courthouse as kind of a mall, right? These are anchor tenants in the mall, right? The courthouse brings in thousands of people every year. The health center brings in, actually, when I left in 2012, 16,000 people a month came into Codman Square because of the Codman Square Health Center. And that feeds all the other businesses in Codman Square, whether it's the coffee shop or the small grocery store or the, whatever is in Codman Square. It's the fact that there's these two anchor tenants of that business district that creates economic opportunity for that overall business district. And in terms of, for us, what we want to do here is expose children as well from our schools into what it's like to be in healthcare. But frankly, we haven't gotten to that point yet. I just had a lot more experience because I was at Codman Square for 36 years, get to do a lot of things in 36 years.
The South End Community Health Center is celebrating its 49th anniversary. What are the challenges, especially now, since it's like we are living since last year in a new country, in terms of
a not very nice country. Well, I can tell you that that the primary care system, your basic doctor, family doc, pediatrician, internist, whatever, has never been at the top of the heap in the medical world, right? They get paid the least of all the doctors, and our system is totally oriented towards specialty care and hospital care. So all the money goes to that end of the hospital world, the healthcare world, the specialists and all that. So primary care has always had a difficult time finding the resources to be able to stay in business. Now you mentioned the T word, Trump. With the breakdown of government in Washington, it's actually, today is Wednesday, so on Friday.
3 days.
Yeah. On Friday, the government runs out of money. And the government has to decide whether it's going to continue funding for community health centers, 1,200 of them across the country, and children's health insurance. So we're in a very desperate situation right now. If the government fails to continue the funding of health centers, we wind up in deep distress very quickly. It's like we get about $1.6 million from the federal government on an $18 million budget. And I really, I'm starting to plan now because I couldn't believe that we wouldn't fund basic health services. I mean, what a preposterous idea that, that somehow we would wind up with a government that could give gigantic tax breaks to billionaires, but fail to continue health care services. I don't understand how people like that can stay in office. But that being said, 2 days from now, we could wind up with losing funding for community health centers, which would create enormous distress. And I don't know exactly what this health center would look like if we lost a $1.6 million grant from the federal government. All I know is that, that it would be very, very difficult to sustain.
That will affect how many people,
26 million, I think, in the entire
No, I'm
country.
talking about, for the center.
Oh, yeah, for staff?
Yeah.
We
Staff and also, the patient, how many people?
We have 14,000 annual patients with 80,000 visits per year, and we have about 200 staff members.
And let's hope we don't get, to that point.
Yeah, I mean, really, I would never figure. I just think I'm 63 years old, and I'm thinking, I can't believe that we're at a point in our country where basic healthcare services would be at risk for millions and millions of people, and we have a Congress that doesn't seem to care. Not only that, doesn't seem to care about young children. It was like, in our country, one of the scandals of our country is the fact that half of all children growing up in America today live in poverty. Half of all children. Okay? It's astonishing to me that in a country as rich as the United States, that we would be willing to say that that's okay. And what the Republican Congress is doing right now is saying that's okay. We don't care. And that to me is a scandal of enormous proportions. So what we need to do is we need to really turn around the way in which people view, the children of our future. These are the people that are going to be working in our dotage years, right? So when we're out there needing Social Security and stuff like that, we're going to need people who are well-trained workers to work in this economy to make sure that we have the kinds of resources that allow us to be able to collect the Social Security check. And right now, what we're saying to those children is, we don't care about you.
If we have to end, this interview with a message, especially, to people watching, what will be that message?
Don't take for granted any of the things that we currently depend on. It's really important. If you care about, about having access to resources such as the South End Health Center or any of your community services or youth services or school systems or whatever, we can't starve them and expect them to be able to continue. And what that means is that people have to be engaged, activist people, residents of the United States. It means that we have to care. It means that we have to communicate to the people who represent us in our government and say, no, we're not going to allow you to give billionaires tax breaks and take away our services or make our schools bad or make our health care non-existent. We're not going to allow you to do that. And if you refuse to do something about it, we're going to replace you. And so that's, to me, one of the main message of today, right? Today is a time when our government seems to be melting down. I would say that, in general, people need to care about the communities that they're in. And if they care about the communities that they're in, then they're going to do things to make sure that those communities are good places for everyone. One of the things I realized really early on in Codman Square was there was a street, I think it was Whitfield Street, where there were 35 drug arrests in one day. 35 drug arrests on Whitfield Street. And I remember talking to the police officer and saying, geez, people must have been calling all the time about drug dealings. And he said, nobody called about drug dealings. It's like people were just used to the fact that they were afraid. And I remember thinking about that and saying, well, geez, they didn't care enough. The people that lived on the street either were so disillusioned with what could happen that they just said, well, it's just what is. And what we really need to do, and what's really important for all of these institutions like health centers and community development corporations, is to make sure people have hope in the future. We need to give people the reason to be that doctor if I want to. I just need to work hard. And we need it to be real. And if those things happen, we will have an engaged community that cares about what's going on in its community, and we'll call the cops when there's bad things going on. and we'll make sure that things are, the trash on the street gets picked up and all that. Those are the description of a good, healthy community is a place where people care, where people have hope. And whatever nonprofits like health centers and all can do to build up that sense of hope in communities, we're solving many problems in doing that. People will be healthier if they feel better about where they live and better about their community and know their neighbors. It's really up to us to see a broader perspective of what healthcare, what community development can do in a community, and not just look at the how many visits we have or whether we're producing X number of apartment buildings or whatever. It's bigger than that. Success has to be determined differently. We have to see that the happiness of a group of people, the hope level of a group of the people that live in our communities is higher. And for that, we need to see our role differently. And that goes for everyone who is involved in their community or involved in a community nonprofit. Look at your role differently. We're really in the hope business, not in the medical business. And if we, through our physicians and our nurses and our social workers and all that, can help people see a better route, a better place, more opportunity, then we're doing a better job than just providing a basic clinical service.
Thank you very much, Mr. Walczak. It was a pleasure.
Oh, indeed, pleasure for me too.